Most people think that the UCAT Situational Judgement section is just common sense. They put down the answers that they think it's going to be and what they would do in the scenario, but then they see band 3 and 4 and they're really confused. Then the second time they end up doing them, you end up overthinking every single answer option. They're vague, they're confusing, and there's so many different aspects that you didn't realize to the question you need to consider. And in this video, that's exactly what we're going to be going over, so I can help you get a top band score. I'm going to be exposing what you actually need to know about situational judgment so you can achieve that top band score. Hi, I'm Lovely and I'm an incoming first year medical student at King's College, and when I applied for medicine I received all of my offers. In this video we're going to be going over what you need to know about situational judgment. Also, make sure you check out the rest of my UCAT series. I have videos on all of the different UCAT sections breaking down the technique, what you need to know to help you achieve that top decile score. And finally, make sure that you sign up to my newsletter using the link in the comments. As part of this newsletter you get access to my free UCAT strategy document, you'll get access to my university guide which helps you know which universities to apply to based on your UCAT score, and so many other resources and different tips into the medicine application process that I post on a weekly basis. So make sure you sign up using the link in the comments. So what actually is situational judgment and what is it testing? This subsection of the UCAT, it has 69 questions and you get 26 minutes for this, which means you get 23 seconds per question. Now that may sound tight for timing, but actually this is not as bad in comparison to the other UCAT sections, and this is actually probably the least time pressured section that you'll have in your exam. Now, the whole point why SJT is tested for in this exam is to understand how are you going to respond in real life scenarios. Can you think and respond how a healthcare professional should? And that is the whole point of this section and why it's so important that you aim for a band 1 or 2, so that again, your universities can see you know how to respond in a difficult situation in a professional manner. Within situational judgment, you are going to get 3 different question types. The first question type you're going to get is appropriateness. As part of your scenario, you'll be given some information and someone will tell you what that task is that they're going to do as part of the question stem. That action that has been given in the question stem, you need to then decide if it's a very appropriate thing to do, an appropriate but not ideal thing, a inappropriate but not awful, or a very inappropriate thing to do. Those are your 4 answer options, and based on the scenario and the task that is given to you in the STEM, that is what you need to put as your answer. The second question type that you'll get is important. Again, with this, you will be given a STEM which gives you information and context, and then you'll be given your question. Within the question, they're going to put an action or they're going to put something that they're considering before taking an action. So it's a factor that is going to be considered. What you need to do, again, is put option A, B, C, or D. Is it something that's very important to consider? It's of minor importance, it's not important at all, or it's relatively important. These are your 4 answer options again, and you have to decide, is that thing that the question is asking you, should that play a part of your decision making? Because there are some things which are important to consider. There are some things which are just there to distract you, and they should not play a part in your decision making process as a healthcare professional. The third question type is appropriateness by ranking. For this question type, you'll be given a question stem, again, which contains your context and information, and instead you'll be given 3 statements. You have to rank these statements as being appropriate or not appropriate. It's also important to highlight that you can actually get half marks in the situational judgment subsection. So if you put down the answer A or B and the answer was one of those 2, you can get half marks if you got it incorrect, and that's the same for C and D. If you, for example, put the answer as C but it was actually D, again you'd get a half mark here, and vice versa. But if you put down the answer as B and the answer was actually C, you would get no marks. You wouldn't get even a half mark in this case, and same if you put down the answer as C but it was B, again you wouldn't get half marks in this case. Now what we're going to do is go over the important content that you need to know so that you actually know how you should be answering these questions. The biggest tip that I recommend to everyone who is struggling on situational judgment is to make sure that you read the document published by the General Medical Council. They publish a document about good medical practice, and this document, it talks about what doctors and healthcare professionals and medical students should be doing. This document is really important. It gives you all of that information, and this is what the situational judgment section wants from you. The situational judgment section is asking you how would you behave as a healthcare professional, as a doctor, as a medical student, and every medical student and doctor has to abide by the good medical practice guidelines. So make sure you give this a read. I'm going to give a brief overview of the GMC in this video as well, but I always highly recommend everyone to read it, because not only is it useful for your UCAT prep, but it's also going to be useful for your interviews. So the better understanding you have of the GMC, the more beneficial it will be for you. The GMC document is actually broken up into 4 domains. The first domain talks about knowledge, skills, and development. As part of this section, the main summary is talking about the idea that as a doctor and as a medical student, you should always always be striving to improve your skills, to reach out for research opportunities, and it's the idea of lifelong learning. You want to always be developing these skills and keeping up to date with any changes that are happening within the profession or any big news that is going on, because you want to make sure that you are most well informed so that you can keep your patients most well informed too. This is where the idea of lifelong learning comes in, and again, this is something you'd probably talk about in your personal statement and your interviews, as it is a really important aspect of being a healthcare professional. This domain also talks about the importance of regularly reflecting on your work, on your practice, and different ways you can improve. It's also important to highlight, because this is one thing that a lot of students forget, is that it's also important to know how far you can push yourself to do something new. Especially, for example, in the SJT scenarios, you might get a question about a medical student who's never performed a procedure before. It's really important here that you can gauge whether there is going to be harm to the patient coming if this medical student, for example, tries a new procedure. Because as part of being a good medical student, a good healthcare professional, is making sure that you're working within your limit and that you're not over pushing yourself. Because if, for example, you try a skill that you've never practiced before, this could actually cause more harm to the patient. So always bear that in mind and weigh up all these different options when you are doing SJT scenarios. The second domain is patience, partnership, and communication. As part of this domain, you will learn that patients are essentially the center of everything that you do. Patient safety is always a priority. You never want to compromise patient safety, and the idea of building that doctor-patient relationship is really important. If a patient is at risk of coming to harm, that is your priority to address that and make sure that it doesn't happen again in the future and that that patient is protected in that moment. This is always going to be your priority in SJT scenarios, and as a healthcare professional, patients are always the priority and the center of everything. Following on from this, another key idea is the idea of patient confidentiality. A really common SJT scenario that gets asked is that a patient is in the hospital and someone comes in claiming to be their family and is asking about their health. This is here going to be breaching confidentiality. You must always make sure that in your SJT scenarios that you have consent from the patient about who is allowed to know about their care, because again, as part of developing that good doctor-patient relationship, is making sure maintaining patient confidentiality, you're respecting that person's wishes. In terms of working with patients as well, you need to remember that you're working with patients and not against them. You should never be forcing treatments upon them, and if patients do decide that they don't want a specific treatment and it's going against your advice, again, patients have the right to make that decision. You cannot force that upon them. It's always important to make sure you're communicating clearly with them. If a mistake has been made, it's really important that you highlight this to the patient. And again, later in the video, we'll be going over the key steps that you need to be following if a mistake has been made. But the most important thing is that clear communication with the patient. Domain 3 focuses on colleagues, culture, and safety. As part of this domain, you're talking about making sure that you have a good culture created within your working environment. What this means is that everyone is being respectful towards each other. All healthcare professionals who are working within that MDT, they feel valued and no one is making anyone else feel bad. There should be no discrimination against any of your team members. And the whole point of this is to make sure that you as colleagues and as a team are able to work together, have respect towards each other and value each other's opinions, because then you can actually deliver better patient care. Finally, domain 4 is acting with trust and professionalism. As part of this and as medical professionals, it's always really important that you are always honest with the patient. Again, if a mistake has been made, you're clear with them. If there's any mistakes made with your colleagues, that you're clear about that with them as well, and that you always behave in a professional manner to maintain that honesty and integrity within the career. As I mentioned before as well, there is a structure for how you should be responding in your SJT scenarios if a mistake has been made. So these are the 5 domains that we're going to be going over for what you should be doing when a mistake has been made. First, it's mistake acknowledgement. If you have made the mistake or your colleague has made the mistake, try to first get them to acknowledge it and understand, okay, this has been made, what can you do about it? Secondly, it's the idea of documentation. You need some way of recording this mistake to prevent it from happening again in the future so that patient safety isn't compromised again. Third, it's having a good clinical response. If your mistake is going to bring a patient to harm, you must immediately respond to make sure that you mitigate any effect of that. For example, if the incorrect dosage of a medication has been administered, you need to immediately try and tell that patient that and try to rectify that error so that the patient isn't coming to any harm. Fourth is the idea of colleague communication. Let your colleague know. This could be someone senior or could be someone that you work with, letting them know about the mistake so that, again, you can document this and prevent it from happening again. And finally, fifth is patient communication. You want to speak to the patient about this mistake so that they have been clearly communicated with and they know exactly what has happened. Again, because honesty and integrity are so important, and that clear communication with the patient to build that trust between doctor and patient. And finally, just going over some other key pillars that are important to know within the SJT. First are the 4 ethical pillars that, again, a lot of you might have heard of these before, but first is autonomy. Autonomy is when patients have the right to make their own decisions, and even if it goes against a doctor's advice or a medical healthcare professional's advice, the patient has the right to make that own decision. Second is beneficence, which is the idea of doing good. We always want to give patients the best form of treatment possible that's going to give them the best quality of life. Third is non-maleficence, doing no harm to patients. Now, with any treatment that is given to patients, you want to make sure that the benefits are outweighing the risks, and if there are risks involved, you're trying to mitigate them as much as possible. And fourth is justice, which is treating all patients fairly, and no discrimination should be shown to any patients at all, and they should all be treated with respect. Now to go over some timing tips. Tip number 1 is to not become complacent with your timing. Now, I mentioned before that this is the least time pressured section of the UCAT, so make sure you are thinking through your answers. You have the time to do that. But what happens is, because people think that, okay, I've got loads of time to think through my answers, it's the least time pressured section, is that they often become complacent with their timing and then end up losing track of how much time they have left, and they have to rush through their answers. So make sure you don't become complacent with your timing. Yes, think through your answers, and you do have that little bit more time, but don't completely forget about your timing and still stay on top of it. Tip number 2 is to actually not use the flag function as much. Now, in comparison to the other sections where you do want to be getting and flagging questions quickly if you're not sure, in situational judgment, it's really easy to start second guessing yourself when you put down answers. So if you are flagging loads of questions, then you're coming back to them again, you're probably going to be overthinking your responses to them. So the first time round that you're doing questions, try to answer as many of them as possible, so you're not having to come back and to redo them after flagging them, as you're more likely to doubt yourself for what the answer should be and end up overthinking what it is. And just a final note is the idea of band 2 versus band 1. Now, the UCAT Situational Judgement, it is ranked from bands 1 to 4, with most universities interviewing for bands 1 and 2 and less of them interviewing for bands 3 and 4. Now, I achieved a band 2 in my UCAT Situational Judgement, and I was still able to apply to all of my universities and able to get offers from all 4 of them. However, the difference between band 2 and band 1 is just one thing. The one thing that I didn't do, and this was a mistake that I made, was that I didn't use the UCAT official question bank. And this is what the difference between a band 2 and band 1 student is. By using the official UCAT question bank, especially in your last week of preparation, you actually think like a UCAT student in the style of that exam. So if you're in the last 1 week of your preparation, make sure that you are using the UCAT official question bank, and this is going to train you to think in that style. And even though with a band 2 you can apply to all universities, you still want to be aiming for that band 1, as it is the highest score, so always aim for that top score. If you found this video useful, make sure that you check out the rest of my UCAT series, as I have videos on techniques for all of the different sections, and don't forget to sign up to my newsletter again so you can get all those insights into the medicine application process.